Hi, my name's Claire. I'm one of the midwives down at Cramlington Hospital. You might see me when you come in to have your baby as I work on pregnancy assessment, the postnatal ward and on the birthing centre as well. I'm just going to talk to you today a little bit about how to look out for signs of an unwell mum and baby in the postnatal period when you get discharged from hospital. Whenever you get discharged from hospital, we'll send you home with one of our lovely little discharge leaflets. Everything that I'm going to speak to you about is in this leaflet as well on the table. We've got a side for mum and a side for baby. Before you get discharged home, we will make sure that both mum and baby are clinically well and fit for discharge. Following your discharge home, we will come out and see you. Your community midwife will come out and see you on the primary visit, day 5 and day 10, unless we need to see you for any other visits in terms of breastfeeding support or you have any other concerns. So we'll start with signs of an unwell mum. So bleeding after having a baby is completely normal. It can last for up to 6 weeks and it can come and go. Usually it starts as a bit of a regular period and then it starts to dwindle off. When we be concerned about any sort of bleeding is if you started to have heavy persistent blood loss, you started to soak pads within less than an hour, or if you had any clots bigger than a 50p piece. We would like for you to contact your midwife straight away or contact the pregnancy assessment unit, so just to let us know. Signs of increased blood loss as well. If you start to feel faint, have any shortness of breath or palpitations, feeling a bit dizzy, just get in contact with one of your midwives. So next thing we're going to look out for is any sort of signs of infection. If you have had a cesarean section or you've had any vaginal suturing, we want to make sure that we're taking care of wounds and sutures effectively. So looking out for any sort of signs of fever or infection, so any sort of shivering, if you feel like there's a funny smell or discharge from down below, if you're starting to get a rash that isn't clearing up or a wound it's taking longer to heal, if you start to feel like you're having a high temperature or any other sort of signs of fever, let us know by contacting the pregnancy assessment unit. We want to look out for any sort of signs of high blood pressure as well. So whether you have any headaches, visual disturbances, any upper abdominal pain, any shivering or tingling sensations, please contact your pregnancy assessment unit as well. So we want to look out for breast care as well. So it's quite normal for your breast to become a bit more full and for your veins to become a bit more prominent. However, we want to make sure we're looking out for signs of engorgement and mastitis. So if you have any sort of red or hot patches on your breast, if they become sore to touch or hot to touch, if you have any sort of nipple trauma or cracks in your nipples, please let us know, as this can be a sign that baby isn't attached to the breast correctly, and it's very easily fixed when we come out to see you and can do a breastfeeding assessment as well. Your feeding should be pain-free and sustainable, so if you feel like it's causing a lot of pain when you are feeding, please let us know, as we can come and prevent any more trauma from the breast by completing a full breastfeeding assessment. We also want to look out for any sort of signs of blood clots. So in the postnatal period, we'll be assessing you before you leave hospital at your risk of having a blood clot. You may be sent home with some anticoagulative medication or blood thinning injections, usually enoxaparin or tinzaparin, and some lovely TED stockings. We will figure out what risk factors you have for an increased risk of blood clot while you are in hospital, and we'll have us all arranged for your discharge. However, when you go home, we're looking out for any sort of swelling in either of your legs, any patches of your legs that are hot to touch, any shortness of breath or chest pain as well. Please get in touch with the pregnancy assessment unit.